tonight and for attending this class, especially under the pandemic circumstances that we're in. And tonight, we're going to talk about children, health, and chiropractic. So I'm going to start out by asking you guys a question. What was it like? What was healthcare like when you were a kid? 10, 11, 12, maybe 14 years old. And how has it changed? Or has it changed?
It was a scary time for us because polio was on the rampage.
Yeah, I remember that.
And the vaccine for polio just got out. And I don't think our school waited hardly a week and then made it available to everybody.
I remember
300
that.
students in the whole school. So it was a scary time because we didn't want to get polio.
Right, and you didn't want to be in an iron lung, and that was pretty scary when
We
you heard
didn't wanna be
stories about that.
crippled up, yeah.
Yeah,
Not being able to go out for sports, not being able to play, to run, to just be a kid.
so right. So setting polio aside, what else do you remember? Who else remembers things? I mean, there's things I remember, especially when I was in my teens, probably more than any other time. But number one is I lived in a really small community from 14 through 17. I lived in a town of 2,500 in West Texas, where the physician in town was like, he was a top dog. I mean, he was like the most prominent, respected person in town, and what he said went, And so I do remember that. Another thing I remember, especially when I was a teenager, later on in my teen years, is how people were put on antibiotics for acne for years.
Yeah.
And not taken off. Years at a time. And antibiotics and Valium seemed to be the drug of choice back then. I mean, if you're a woman and you had a health problem, you'd get Valium, okay? Other health problems, if they didn't think Valium could take care of it, they'll always put you on an antibiotic. That's one of the things I remember really vividly about growing up and the healthcare then. And people then, weren't put on nearly as many pharmaceuticals as they are now, but they were put on them for longer periods of time, it seemed like. So, anybody else want to talk about anything they remember about growing up, healthcare, anything?
We
I
didn't go
remember-
unless we absolutely had to, and if Dad's checkbook could support it.
Yeah.
Otherwise, Dad would put out the great big sulfa tabs, and we'd scrape it in the wound and say, "Here goes.
Yeah.
Give it some time."
So it was rationed, really, based on whether you could afford it or not. Yeah. Yeah, there was some of that in our house too. Adam, do you remember anything specifically?
My impression of it was that I didn't see the doctor that much. Most of the kids I knew didn't.
Uh-huh.
It was just, there were a few vaccinations that you got, like I think 2 or 3. And, you just didn't see the doctor. I mean, for a lot of the pediatric visits that a lot of kids go through on a regular basis now, just didn't seem to happen back then. And that was in the late 80s, early 90s.
Yeah, okay. So I remember we didn't go to the doctor very much either, not very much at all. And I think that one of the things I remember growing up, at least with my mother got really ill when I was in high school, and that's when the doctor still made house calls, and he came over, and she had a lot of back pain and headaches, and he put her in some traction, and finally she found out about chiropractic and started going there, and started getting some help, and this is way back in the 1967, 68, 69, right around there. And so that was the first time that I ever realized that there was another healthcare system that didn't involve pharmaceuticals. And so kids, kids get sick, and we know that. But kids also have a spine. They also have an autonomic nervous system, just like we do. And when you adjust their spine, their autonomic nervous system turns that on just like it does with us. They still get vertebral subluxations, okay? And it's no wonder they trip, they fall downstairs, they do all kinds of things. They still get all that stuff. And so the first subluxation that a child often experiences is birth trauma. And this is out of Medscape, which is a very traditional medical website that I used to access all the time when I get information for my radio show. In fact, this article here probably was on my radio show. The risk factors for birth trauma include bigger than normal infants, you know. So if it's a small woman and a large husband, you get a fairly big baby, and sometimes it's hard to get that baby out. So 4,500 grams is about 10 pounds, okay? So more than 10 pounds. Instrument deliveries, forceps, vaginal breech deliveries, excessive traction during delivery. Here is what it looks like. Here's a C-section where they literally pull the baby out by the head. So C-sections aren't where they reach down in there and just bring the baby up gently. They're a lot of times pulled out by the head, and that can cause injury to the neck. Here's an article out of Orthopedic Medicine. It says birth trauma to the cervical spine and cranium can result in disorders such as headaches, vestibular problems, auditory problems, visual disturbances, pharyngeal disorders, which is, you know, the throat and the voice, vasomotor and secretion dysfunction, and psychic disturbances. Care to realign the neck achieves excellent results with many of these dysfunctions. So this is not a chiropractic journal that's saying that. Now, can chiropractic help kids with infections? How many of you had infections when you were little? We all did. We had sore throats, you know, we had tonsillitis, we had all of that.
Canker sores.
Yeah. And so research shows in the journal JMPT that a single chiropractic adjustment causes a burst in the amount of neutrophils and monocytes, which is part of your immune system. And these are cells that tend to kill off infections. So what about chiropractic and respiratory disease? Again, same journal, JMPT in 2012, says the use of manual techniques on children with respiratory diseases seems to be beneficial. Chiropractic, osteopathic medicine, and massage are the most common interventions. Now here is a really interesting study. This is in the journal of the American Osteopathic Association, 1966. I mean, that's like, I was 13, how old was I then? Not very old, okay? So this study involved 100 families, 4,600 cases of upper respiratory infection in children. And here's what it showed. Osteopathic manipulation was superior to antibiotics for these problems. If children were adjusted as soon as symptoms began, complications were less frequent. Most of the time, complications such as bronchial pneumonia or conjunctivitis could be treated with extended adjustment periods. And the only time these kids needed antibiotics in this study is if the manipulation did not work over a period of time. Then they used antibiotics. Prophylactic use of antimicrobial drugs could cause complications to be more difficult to treat. That's 1966. That's I was 13 at the time, by the way. So that was, you know, this is back when this kind of stuff was considered utter quackery. I mean, nobody was doing this. Nobody treated an infection an upper respiratory infection in a kid with adjustments. But this was a study, and it was a lot of this is a large sampling. So when you have a large sampling like that, you get a much more accurate study. What does the AMA have to say about antibiotics and respiratory infections? This was February 2016. More than 250 million outpatient antibiotics are written in the U.S. each year, most of which are for acute upper respiratory infections. A large proportion of these prescriptions aren't even necessary. Antibiotic overuse leads to unnecessary adverse drug effects and antimicrobial resistant infections, which harm patients. Now, I think the overuse of antibiotics has been going on for a long time. It certainly happened when I was a kid. My personal opinion of this is that it's the overuse of antibiotics in the 50s, 60s, 70s, and 80s that has led to this just explosion of autoimmune diseases. I absolutely believe that there's and there's science shows that there is a correlation there. You screw up the bacteria in your gut, you cause leaky gut, cause systemic inflammation, food intolerances that can lead to autoimmune disease. What about chiropractic and epilepsy? Chiropractic care may represent a non-pharmaceutical healthcare approach for pediatric epileptic patients. Now, we don't have a lot of long studies on this, and this is something that needs to be studied because this is more anecdotal, but current anecdotal evidence suggests that correction of the upper cervical subluxation complex might be most beneficial. It is suggested that chiropractic care be further investigated regarding its role in pediatric epileptic patients. Now, I haven't had a lot of those patients. I like more of them, but this is 2001, and we do need a study on that. I mean, epileptic problems are brain dysfunction. We know that we know absolutely conclusively that chiropractic care makes the brain work better. So why wouldn't it help an epileptic patient? We really need to do some research on that. Here's a very interesting study that came out, I think 10 years ago. I have to look. But we looked at chiropractic care versus medical care. 200 pediatricians and 200 chiropractors were sent questionnaires on the health of their children who are under different types of care. And here's what this showed. It showed the chiropractic group had fewer ear infections, less tonsillitis, fewer allergies, and fewer cases of asthma. The health of the children under chiropractic care is demonstrably superior to the children who had not received it. It's an interesting study. A 1999 study which compared chiropractic and pharmaceuticals in the treatment of colic showed that chiropractic care was superior to those drugs. This is one that I really like, Heidi Havoc. And I talked about her a couple weeks ago in the talk that I did. She's one of the most prolific researchers in chiropractic. She got a PhD in neurophysiology. She does a lot of great research. She's published over 50 research articles in various journals on how chiropractic affects brain function. And what she says in her book, which I read recently, is this: chiropractic care has been proven to modulate or improve sensomotor integration. So what is that? That's the integration of sensory information in the brain to perform movements of the body accurately. So this facet of chiropractic care could greatly help clumsy kids or kids who tend to be accident prone. Okay, you ever known kids like that? Yeah, all of us have. Okay, well, what Heidi Havoc is saying is that it's very possible that their brains of these kids are not processing what they're experiencing out in the world, and because of that, it's not processing it properly. These kids then they get clumsy, and in fact, I think she may even be doing a study on this now. But she said that when you adjust kids and they can process what they experience better, you know, they're going to get more. They're not going to be as clumsy. Now, there's many published studies that show that chiropractic can help with bedwetting. B vitamins can also be helpful with that. And I've treated kids for bedwetting, and it does work. Sometimes it takes a while to fix it, but it does work. Here's a case study in the Journal of Manual Medicine back in 1992. Shows abrupt improvement in the mental and motor deficits of a 14-year-old girl after the initiation of specific upper cervical chiropractic care. Now, I have a patient right now who's a special needs patient, and he's been under my care for, I don't know, 3 months, 2-3 months. And, you know, I asked his mother, I said, you know, how's he doing? Because when I ask him, oh, everything's the same, nothing's changed, you know, nothing's ever different. I asked his mother, I said, how's he doing? His mother says, he's improved dramatically. I mean, he's more peaceful, he can sit still better, he can, you know, he doesn't get upset as easily. And all I've done is adjust him. That's all I've done. What about chiropractic and athletes? So here's an interesting study. This is a Journal of Chiropractic Research and Clinical Investigation, 1991. They divided 50 athletes into 2 groups, and 11 tests were used to measure athletic ability. Now, these were kid athletes. These weren't adult athletes. And so after 3 months, it was demonstrated that the chiropractic group improved significantly on all 11 tests, where there is no improvement in the control group. So this tends to indicate that adjusting kids really helps with their coordination. Okay? And by the way, interviews and surveys have been taken show that 90% of all Olympic athletes are under chiropractic care, not because they're in pain all the time, because it helps them perform better. Chiropractic can help kids with tonsillitis. This was in Dynamic Chiropractic 1994. Now, this is not a peer-reviewed journal, but it does have some interesting case studies in it. In 1975, the Journal of Trauma reported that trauma to the cervical spine is a cause of chronic headaches. Now, children can get spinal trauma through minor falls, auto accidents, and sports that can cause headaches. This is in the Journal of Neurosurgery Pediatric in 2019. Children and adolescents may be vulnerable to prolonged recovery from concussion than adults, may be more vulnerable. So it takes them longer to get better because their brains aren't as developed as an adult. So a particular time for developing persistent symptoms after a concussion is when they're teenagers. Well, when do a lot of boys start playing football? When they're teenagers, yeah, okay? And during the teenage years, girls carry a higher concussion risk than boys. Why is that? Anybody?
Unless it be high heels, I haven't a clue.
That's an interesting answer. That's one I didn't expect.
I don't have a clue.
Blame it on the
I
high
was gonna
heels.
ask
Yeah.
why.
Yeah.
Because girls are getting more into basketball, volleyball, and softball. My daughter's played all those sports very heavily.
Yeah. Well, that's one reason they're doing a lot more sports. But
Yeah,
but if you look at the literature, I'll just say this: concussion always includes cervical problems. So if you look at the neck of a girl and the neck of a boy, who has a bigger, more muscular neck?
man.
Guys do.
Yeah,
Yeah, they have more muscle.
like a bull.
Yeah, so they don't get injured quite as easily as girls do.
Okay.
Mild traumatic brain injury can be helped with chiropractic low-level laser and specific nutritional formulas. The study came out in 2017 that showed unless the cervical spine is corrected with specific manipulation, brain injury may be long-term. So you have to fix the neck. Now, I have found that using low-level laser, really good for upregulating brain function. There's some really good studies on low-level laser and how it helps heal the nervous system and brain and brain cells. And I, in fact, last August, I have a young lady who's a patient of mine who was concussed in a soccer game. It was right before I went on vacation last year. It was last year. And she came to me that the day I was going to leave, and I did an exam on her, and she was, she was unsteady, and she'd been hit in the head very hard with a soccer ball. And she'd seen me a talk on this, and she says, I think I'm going to come to you rather than my MD, and I'm going to see what you can do. And so I did everything I could for her, lasered her, adjusted her, and she was good after that. I mean, she was almost like, next time I saw her, she pretty much fully recovered. So a lot of injuries, sports injuries in high schools can really be helped with chiropractic care. A lot of your soft tissue injuries, when you have a fracture or something like that, that's out of our realm of scope of practice. But boy, concussions can be really, really helped with chiropractic a lot. By the way, what nutritional formulas do you think that you would give for a brain injury, concussion injury? What do you think? What do you guys think? What do you think would be the thing to give?
The B's and the C's, you want to give support to nutrition and healing.
Okay.
Let's see, honey.
Honey?
Honey
Okay.
would be
Why do you say that?
Well, it ups the immune system. It
Okay.
improves the immune system. It's like a spark plug.
So, if the brain is injured, what are brain cells made out of?
Fat.
Fat. Okay. Right. Good. So, if the brain is injured and the brain cells are made of fat, what's the thing that you'd want to do to help repair those brain cells?
Fish
Diet
oil?
of fat.
Fish oil?
Fish oil. That's right. You want to give them fish oil. So that would be one of my number one things that I'd want to give them is fish oil. Okay. So fish oil helps repair the brain cells because the brain cells are made of fat. There's a high polyunsaturated fatty acid content in the brain. What else does fish oil do that is important, that would be important for the situation here?
It decreases inflammation.
Bingo. Yeah. I knew you had to get that one, Adam. Yeah, it decreases inflammation. So when you get your bell rung, there's inflammation in there. There's an inflammatory response. So it decreases inflammation and it helps repair the brain function because the brain is primarily made of fat. So like coconut oil would be good. That'd be another good one that you could give them. Any like fatty fish, salmon, things like that. They should be eating that stuff. And then they should be tested regularly to see when they're ready to go back. And there's some tests out there that you can give these kids to find out when they're ready to be back on the playing field again. Now, when I was in high school, back in the 60s, early 70s, do you think we knew any of this back then? I mean, I went to school in West Texas, high school. That was Friday Night Lights, okay? That was where football was like worshipped, okay? And these kids they were treated like professional football players. They get injured, they'd smack them in the head and say, go back out on the
Get
field,
back into you,
Yeah, especially if it was a really good player, they'd play through injuries and there's a lot of things that went on back then that we wouldn't tolerate now. Nobody would tolerate, and so we've come a long way since then. But in fact, you know, the truth be known, because of what we know about a CTE, that, you know, football really does damage the brain. And there was a study that was done on college football players that had died, and they looked at the brains, and every one of them had chronic traumatic cephalopathy, CTE, encephalopathy. So, you know, I love football. Listen, I'll admit it. I love it, but it's not good for people. Okay. So, the best doctor is the one that's inside of you. So here's what I'm going to say. Here's the last thing I'm going to say tonight. You know, some of you people know people that have been injured, athletes, kids that may have been injured and that may have ongoing problems. And if they're not getting better, you know, chiropractic can help them. And I would say, tell them what I do in the office. Have them come in. Let me talk to them. You know, if anything, we could just give them some fish oil. But a lot of these kids, they need to be adjusted if they're going to get better and they're going to stay better. So I would invite you to let us, you know, we'll give them a complimentary subluxation check, see if they're a good candidate for office. And if they are, we'll treat them and we'll help them. Because this can make a big, big difference for them later on. And other kids that are having health difficulties, a lot of times, many times, chiropractic can correct that. They're not having a pharmaceutical deficiency issue. They're having a problem with their autonomic nervous system or with nutrition, and those are the things that we can help them with. So, with that, I'm done. I got done a little early tonight. Any questions? No questions?
Back in high school, if, let's say a girl, let's say she was active in volleyball,